Hello, everyone, and welcome to this virtual chapter panel session entitled Key State Health Legislative Issues Facing Leaders and Potential Responses, presented by Indiana Healthcare Executives Network. I am Craig Thompson, your session host representing the National Office of ACHE, and I speak for everyone when I say we are glad you are here. Before we get started, I would like to go over a few items to help you navigate the program in our virtual environment. For the purposes of noise control, your lines will be muted for the duration of the session. However, we welcome and encourage you to submit questions at any time through the chat function in Zoom. If you are on the go during this session, please participate using the Zoom app. And also, to help ensure you receive your learning credits, please make sure the name that is showing up for you in this Zoom session is the same name as the one you registered with for the event. Today's session is worth 1.5 hours of ACHE face-to-face education credit. Credit will be applied to your ACHE account approximately 2 weeks following the end of the session based on your live session attendance and completion of the evaluation. This session is being recorded and will be available within 48 hours by navigating to your My ACHE account and selecting My Online Learning from the Helpful Links section on the right side of the screen. Now, to begin the session, I am happy to turn it over to the chapter president for Indiana Healthcare Executives Network, Chad Dilley. Chad?
Hey, good afternoon, good early evening to everybody. Thank you all for joining us. I want to send special thanks to the program committee for being able to put on this great virtual event. I want to take a moment right now to thank our sponsors. First and foremost, I want to thank Ice Miller, our premier sponsor. We appreciate the sponsorship there and the support from Ice Miller. Also, Heapy Engineering. Today's brought to you a little bit by Heapy Engineering. End of Care, Cat Sapper Miller, Cornerstone, and Art Design. So thank you once again to all of our sponsors. We would not be able to do this without you. We're going to go through just a couple updates here from IHIT, and then we're going to turn it over to an excellent panel here. And I just want to say thank you to everybody that's participating tonight with this. In a season right now, I was on a call with Brian and until about 7, a little bit after 7 last night. So I appreciate everybody's efforts with this. In terms of our upcoming events, we have a couple upcoming events. We have the Indiana Rural Healthcare Association that we have an upcoming event where you can capture qualified credit.
So I think we are having some connectivity issues on Chad's end. Ben, I don't know if you could take over, or Corey, to share the information about the upcoming events.
I'd be happy to. As Chad was saying, we have the Rural Healthcare Association virtual conference next week where we are offering 8 qualified education credits. We also have a virtual advancement information session offered next Thursday, the 19th, from 4:30 to 6 p.m. that you can still sign up and register for.
Excellent. Thank you so much, Corey. And if there are no other announcements from the chapter, I would like to turn it over to your moderator. Go ahead and take it away, Ben.
Great. Thanks so much, Craig and Chad and Corey for pinch hitting here. So my name is Ben Miles, and I have the privilege of serving as the president of Health Plan Services and Chief Advocacy Officer for Parkview Health here in Fort Wayne, Indiana. Like each of our panelists, we're just so honored that you would take time out of your busy schedules to join us this afternoon and dive into some really important topics here today. But before we do, I think it would be really important just to share a little bit about each of our panelists here. We've got just some real experts who are deeply engaged in some of these topics. So would like to just share a little bit of the biographical information on each. And I'm actually pretty excited to start with my state senator. So Indiana State Senator Liz Brown has served Hoosier since 2014 as a member of the state Senate, and she represents District 15, which includes portions of Allen County, including my stomping grounds here. Liz was recently appointed the Assistant Majority Floor Leader for Communications. She's the chair of the Senate Committee on Ethics and also serves as a member on the Senate Committees for Appropriations, as well as Health and Provider Services. As if that wasn't enough, she's also a member of the School Funding Subcommittee. She holds a bachelor's in science from University of Notre Dame and picked up her JD from the University of Iowa. She and her husband, Steve, live here in Fort Wayne. They're the proud parents of 7 children, and perhaps my favorite fact, they're the proud parents of 2 cats named Walker and Texas Ranger and a new puppy named Corby. So Liz, thank you for sharing that fun fact. She's joined by Brian Tabor. Brian is the president of the Indiana Hospital Association. The IHA represents the interests of nearly 170 Hoosier hospitals. The association is the chief advocate for hospitals and their patients, representing their interests with the state of Indiana, the federal government, business community, and regulatory agencies and other stakeholders. Prior to joining IHA in 2008 as vice president, Mr. Tabor worked in various policy roles with the Indiana General Assembly and in government relations for the Indiana Association of Realtors. As a testament to his passion for strong communities and improving quality of place, he currently serves on several governing boards, including Covering Kids and Families of Indiana, the Indiana Health Information Exchange, the Sycamore School, the Indiana Fiscal Policy Institute, and Mr. Tabor also graduated from Purdue University with a Bachelor's of Arts in Political Science and a Master's of Science in Agricultural Economics. So thanks so much for making time to join this afternoon, Brian. And last but certainly not least, I would like to extend a warm welcome to Mark Medley. Mark is the regional president and CEO of Lutheran Health Network, and he's been in this role since March of 2019. Mark is broadly recognized for his ability to produce strong operational and financial results within complex healthcare organizations. Medley has extensive experience optimizing and leading healthcare systems at various levels. Prior to joining Lutheran, he served as president and CEO for Alley Healthcare Advisory Services, where he provided strategic counsel to healthcare systems and investors. His past experience also includes time as executive vice president and group president for RCCH Healthcare Partners, as well as EVP and COO for Capella Healthcare. He holds a bachelor's degree from Tennessee Technological University and a master's degree in business administration from Western Governors University. Lastly, he's a proud fellow of the American College of Healthcare Executives. And on a personal level, I can share that I've had the opportunity to see Mark at work in our community and appreciate the expertise and engagement he brings. So Mark, thank you for joining us here today. Well, it was something as I was preparing for this event today, I had to think back. It was in early February that Chad, Jeff, and the iHen team first reached out to me to even discuss this event. And at that point, COVID-19 was still largely a headline. And it was only several weeks later, near the middle of March, where the president would declare a national state of emergency for the pandemic. Without question, we will have conversation, and COVID will play a factor in our discussion this afternoon. But if the panel would indulge me, perhaps we could begin with more of a macro level view on things. So access to healthcare and improving health status are key areas of interest for many across the state of Indiana. And we can agree that this involves numerous factors, programs, and stakeholders. The three of you have such important perspectives on this topic. Brian, maybe I could start with you, given that you represent such a comprehensive array of healthcare providers, that you're in a unique position to discuss some of the themes that you've seen, be it large urban or small rural health system or independent facilities. So maybe in some of your opening comments, what do you see with regard to these topics? What's working here in Indiana?
Well, thanks, Ben. Appreciate being invited to be a part of this great panel and to see you, and appreciate any chance to kind of listen and learn from our members as well in terms of what's going on. And we can talk about statewide, and I'll certainly do that, but it's always great to hear what's going on in a community like in the Fort Wayne area with 2 great health systems there. So thank you. I think one of the things that we've learned that the pandemic, and I won't talk about that specifically at this point, but one of the things I think it has laid bare are challenges and opportunities. I think we've learned that throughout this, there's underlying fragility particularly in rural healthcare. I think that's a macro trend across the country, and I think that does exist here in Indiana. We saw the bankruptcy of a community hospital down in Connorsville. That was before the pandemic. So I think that underlying fragility is a concern. I think we've learned about the fragile system that we have regarding behavioral health. So even we're talking a lot about COVID and cases and acute care, but we've learned throughout the pandemic again that we have serious behavioral health challenges in our state, not just the shortage of providers, but the conditions. We've seen rates of suicide and other serious behavioral health conditions increase. Some pretty concerning trends there. So I think that's one thing that we know we're going to have to work on long term, not just now, but in the long term. But I think we've also seen that we've got great opportunities. We've seen a healthcare system that has been very nimble, that has risen to meet the challenges, and we certainly have some now, but I'm very confident we'll be able to do that. Telehealth, I imagine we'll touch on that later, but we've seen that technology can play a key role in helping to ensure access, even in the midst of COVID-19. And we've had great leadership. And we've had great leadership in the state of Indiana. We're fortunate to be in a state that has significant reserves, that has been very prudent fiscally, which is going to be important for our long-term recovery. And I think the governor, leaders like Senator Brown and others have definitely put us in a good position to be able to flourish once we get to the other side of this challenge.
Thanks, Brian. Senator Brown, maybe you could amplify some of your thoughts on what Brian has shared, and from your leadership position in government, your thoughts on this topic.
Yes, thank you. And thanks for having me. And I am kind of fortunate to be on the panel, and I have the two best health systems in the state of Indiana in my own backyard, and they're on this panel with Lutheran and Parkview, so I'm particularly blessed. I do think the positives, if we start with that, is we understand more than ever the need to have local health systems that are vibrant and robust. And when you want to get your health system care immediately. And what I've also been particularly appreciative is the collaboration that has happened, not just in my own community, but across the state. Every hospital system has different strengths, and I see them all working very well together. The other part that we've seen a lot of, obviously, is the telehealth. That is something that I know legislators have sort of worked around the edges. We're cautious and conservative in Indiana, but I think this has brought to the forefront the need for us to address how we can better serve not just our rural communities, but when you have something like this health crisis and people cannot or do not want to come into an office or a hospital system, how we can address that. That's important. The negatives, I'm going to definitely second Brian Tabor's comments about the mental health. That is a huge concern for all of us. The good is that we know we've been delivering some of that through telehealth. We also know in the past couple of years, we've expanded the Medicaid access to that, but still, I don't think we've met the need yet. We know, and across the board, whether it's mental health or any health provider, we still have a lack of staffing. That is a huge need. And I'm sure the hospital systems who have been hit either with COVID positive staff or just have quarantine staff, you feel that definitely. So that is something too that I think I'm going to have to really work on my fellow legislators and how we can better address that.
Thank you. Well, we're certainly fortunate to have you as an advocate, so appreciate your thoughts. So Mark, as the provider of care and of one of the leading health systems in the state, would really appreciate you kind of opening your thoughts with this.
Thank you, Ben. Let me say as well, it's an honor to be here today. Thank you for the invitation. It's certainly a distinguished panel that I'm honored to join. As Ben said, I am honored to be joined by my state senator, Senator Brown, as well. So we appreciate all the support, Senator Brown. And let me just say, not pandering whatsoever, but prior to coming to Indiana, I had the good fortune to work in 25 other states over the last 15 years, was chairman of the Tennessee Hospital Association, and then served on that board for several years. I have to say, we deserve a lot of appreciation to the Indiana Hospital Association, led by Brian and his team. They're an outstanding hospital association, lobbying and advocacy on our part every day. And so it's certainly appreciated deeply. I would echo the comments of others. The behavioral healthcare access is a national crisis, not only a crisis here in the state. It only has been heightened by the COVID pandemic, and I think we will continue to see the effects of that for some time to come. So helping to ensure that access is there for those needs is vitally critical, almost rising to the level of a national crisis, which I do believe it is. I would have to, again, working in many other states before coming to Indiana, really appreciate and want to recognize the foresight and leadership of the state officials that led to the Healthy Indiana plan being implemented. Seeing states where that has not been implemented, that is critical to helping ensure that the access is there for those who need that. Primary care access, the access, and then the initiatives in the state as well for maternal health. The initiatives led by Dr. Box and others around the perinatal standards, I think only goes to strengthen where the state is on quality access to healthcare, and then just general access as well. So it's an honor to be here again in the state. It's an honor to be here on this panel today. Thank you.
That's great. And thank you all for your opening comments. Mark, if I could maybe stay with you for a moment. One of the things that I was intrigued about in your background is that you do have so much experience in so many different states. So it's heartening, not surprising to hear you share some very positive views on how we manage ourselves. We know that Indiana is a state that works. Let me ask you this, though. Are there some things that you've experienced in other health systems or other states that maybe is a barrier to care here that you would say we might want to consider when you think about access or overall health?
That's a great question, Ben. And, I think, many of those issues came up in the past state legislative session. Many of those were, I think, addressed, particularly as great starting points. The transparency issues, helping to eliminate surprise billing in the industry. Those are all things that we as providers, I believe, have a responsibility to help ensure that occurs. It's what payers and consumers of healthcare are expecting. So I applaud the state for steps in that direction. The payer access database that we discussed, the state just implemented. I've seen that implemented in other states over several years. It does take a while for that to work as intended, but you have to start somewhere. So I certainly applaud the state for moving in that direction. And then again, as it's been highlighted in many different reports and varying opinions, but I think overall we as healthcare providers have an obligation to help lower the cost of care while improving the quality of care. It's what, again, our consumers of care expect. And it's something I believe that as providers, if we don't address, then the government will attempt to address in other ways. And I think we would all rather be a part of that solution rather than have it forced upon us.
Well, we've touched on, thank you, Mark. We've touched on some tremendous topics, and I think it's almost regretful we don't have too much time to get into all of them. But since we kind of focused on cost here for a moment, let me just kind of pose this to the panel broadly. There continues to be a significant focus on clinical practice and not just cost, but even the variation between states and even among providers. So let me ask, either from an association, an organizational, or a legislative perspective, what are some possible solutions that you can think about? We talked about the all payer claims database being one, but what are some things that we can do to measure and improve value when it comes to cost and variation?
Well, I'll throw one thing out and just say that we're taking some steps. Mark said it very well. We took some important steps in the General Assembly. Senator Brown was very involved with that. Appreciate her support and working through a lot of complexity with some of those bills. We took some good steps here. I think we also need to recognize that those steps we should build absolutely more transparency for the individual, and we're committed to working on that. But at the end of this, we should also be shooting for, I think, changing the way that we pay for healthcare and contract, because at the end of the day, we can compare states. We found out that Indiana, for example, is one of the lowest states in the country for physician payment, based on several studies that came out this year. So, I think we absolutely need more transparency, but we need to make sure we don't get, we start arguing about this statistic or that statistic, because states are very different. But the way to really change and bring more value to businesses who purchase insurance, to the individuals, is to be paid for outcomes, for quality, and move away from the fee-for-service model that we have. And Indiana, we're a little bit more stuck in that fee-for-service model. And Mark, I don't know if that's kind of your observation. I think some other states have taken some steps to get a little bit further down that road. So I think we need to do good work on policy in the short term, but let's also keep working towards the longer term vision of changing the way that we pay for healthcare in a way that I think is a win-win for everybody.
Thanks, Brian. Other thoughts on this topic from either Mark or Senator Brown?
I couldn't agree. I think that we're cautious and we are a little bit slow. I'm not going to speak to the fee for service, but I do appreciate the cooperation we've had with the insurers and the health systems when we talk about transparency. These aren't things I know that you can change overnight, but what I think I'm also cautious about when we totally flip the model. I think the one thing I've noticed out of this COVID pandemic, if you will, is legislators certainly appreciate having their own hospital system, but they also understand it's expensive to have that rural hospital, that critical access hospital, stay open in their community. So obviously, some of we had some pretty difficult decisions and conversations about why some of our costs appear to be in these various studies higher than other states, and not just because we don't have the healthiest population, but we also have to look as a state, what can we do? How can we partner better with some public health initiatives? Mark mentioned, for example, the OB Navigator program. I think we can do more in that kind of thing. And so it's a combination of things, but I think it's easy to look at a study with dollar amounts and not look at outcomes. And frankly, I will put my Senate's healthcare systems behind my state's healthcare systems behind any others in terms of the quality we deliver. And we just have to do a better job of making sure we're transparent in what the costs are.
That's excellent. Thank you. I think as we've talked about some of the different programs, like an OB Navigator program, I can't help but think that it just really kind of drives toward what has commonly become known as social determinants of health. And I think for those of us on the call, we're probably very familiar with that. So it can be things like access to transportation or employment or income or a person's living environment. Excuse me. Well, this obviously, these factors have a huge impact on health and well-being. And it obviously drives a lot with regard to health disparities and those outcomes. So I guess, Mark, as an operator here, could you maybe talk about some of the things that you and your team are doing to impact and maybe get a little further upstream?
Certainly, Ben. To your point, I think, reaching out to the community, trying to be that resource that not only helps with the access to, various care models, it's, helping navigate, the healthcare system that's difficult and transparent or very confusing to most. It's, helping ensure, access to medication, mentioned transportation. I think all those things are vitally important. I think it's also something that we as a healthcare industry can work closer with our elected officials and regulatory agencies on. As you know, and everyone on the call knows, there can be certain regulatory limitations as to what we can do as providers around transportation and providing some of those other things that help improve health overall. And that gets to the point I think Brian made earlier and Senator Brown echoed, which is ultimately we want to be paid for outcomes, but to be able to do that in a holistic sort of way, some of the historical hurdles to being able to do that, I think need to be considered and removed at some levels to provide for that more holistic ability to provide that care and be more involved in what that actual outcome may be that we're paid for, as opposed to being very limited in the ability to control that.
Sure. Thanks, Mark. Brian, with 170 members, I see you coming off of mute. You've got to have one or two at least, right?
Yeah, I was just going to share as what Mark said it very well. We've got to look at programs, I think, that have a return on the investment, and we need to bring those ideas to legislators like Senator Brown, who sits on the most important fiscal committee in the Senate that'll be writing a budget, which is going to be a really tough budget to write. And I think we'd all like to have those of us here are public health advocates. We'd love to have more funding for public health. We know, Indiana ranks, reasonably low there, but there's different ways to measure that. But there's not going to be a lot of funding in the short term. So I really want to challenge everyone to think of ideas along the lines of what Mark said. So are there regulations that we can get out of the way to improve quality that maybe don't cost a lot, but really can make a difference? And also, what are those key programs like the OB Navigator that have a return on investment? I think what's so exciting about that, certainly the governor and the General Assembly have been supportive of it. It kind of came more organically. It was based on a program I think that started up in South Bend, and looking at the success that had with affecting the African American infant mortality rate by working with African American doulas, and then what the state's done then is take that program and say it's not a one size fits all. We're gonna let you kind of design it for your own community, and that's exactly the sort of thing that we need to do. We need to be able to replicate those models in other places. I know there's at least one place in the state. I actually tried to find my note on this because the American Hospital Association has a challenge grant out for working with pregnant women, infant mortality like challenge grant. And I know they've had tremendous success with giving blood pressure monitors, pretty small expense to expectant mothers, and they have a home monitoring program, and they're doing that, and they're seeing great results. And so that's a program that could be replicated. It's got great results. But when we come back to the regulations, like Mark said, you have to be really careful about even giving a blood pressure monitor away because of the regulations. So if we could get some of those things out of the way, we could do, I think, some even more cool programs at the local level, prove that they work, take them to policymakers, and try to replicate them at a large scale.
I would just interject. I actually think, at least in my community, the hospital systems are doing a lot of community outreach that I may know about anecdotally, but we don't know about at the state level. And so it's good to replicate them, but you certainly don't want us deciding what the best program is, and one size doesn't fit all. And I know in our community, we have some different types of outreaches. I call it the Crawfordsville model, where their EMS goes out and have had tremendous success with bringing high-risk moms to term with healthy babies. That's a totally different system. So I think that's what's great is, and we as a state, just sort of to Brian's point, although he would be more diplomatic, we need to stay out of the way, and as best we can on a state level. Obviously, some are federal issues, but as a state, try to make sure that you're able to do this without us putting impediments there.
We certainly appreciate the thoughtful way that you've approached this, you and your colleague, Senator Brown. I think that knowing that we have a partner to work on this is key. And I think as we touch on not just these issues, but it kind of gets into a lot of the discussion that's happening at a broader level around health equity. And that certainly touches on racial and ethnic lines, certainly income disparities that are there. So I think really collaborating and working well together is going to be a key as we continue to improve upon some of the great progress. I was thinking we've touched on infant mortality, and I know that Governor Holcomb was pleased to share that our infant mortality as a state has fallen to the lowest level it's ever been. And I don't think anyone is declaring success at this point, but still it's so encouraging to know that because we're being intentional about our actions and forging the right relationships, that together we are seeming to make a very good difference here. One topic I think would be helpful, and I see on the chat here, Sarah has actually mentioned this, and each of you, I believe, touched on this in your comments earlier, but just the idea around the impact of and access to mental health and substance abuse care. Certainly COVID has amplified that. Even before COVID, I think we were all very much aware of the impact of the opioid epidemic and a lot of other scourges that have continued to just wreak havoc in our communities. So maybe you could talk about, from your vantage point, kind of what you see, what contributions you bring to helping to work through some of these issues around mental health or even substance abuse care. And I'll pick on my buddy Mark. So I'm wearing my Lutheran tie. I'm going to call on you and use my one freebie.
Thanks, Ben. I like the tie, by the way, and I think it's now fair ground that I can wear my green ties that I've missed wearing.
Perfect.
So, hey, perfect. Anyway, that's funny. No, behavioral care access, and obviously, as Ben said, the scourge of the substance abuse, particularly the opioid addiction, that's just ravaged the entire country. In our organization, we have an adult behavioral healthcare unit currently at St. Joseph. As the new Lutheran Downtown Hospital is being built, that hospital was actually not designed to incorporate behavioral health services. However, we are looking to expand behavioral health services in the Fort Wayne community to serve the region and the community around that. So, to the point, and I know Parkview is doing many of the same things in the community to serve those behavioral healthcare needs that are so rampant. Telehealth, we talked about that earlier. That's something that we are focused on, in particular around this population, of getting those services out to the emergency departments that become so overwhelmed many times with this population that there's needs, yet there's not a bed or a resource to send those patients to, and they simply get unattended to in the emergency departments, which not only is an issue for that particular patient, but slows down the rest of the emergency room processes. So we're using telehealth to help expand that, to help move patients more timely through the system, to help ensure that they get the care that they need. So I think it's an ongoing collaboration that we're going to do with community resources. Again, I think it's a partnership that we need to have with our government officials, and just continue to talk about what the real needs there are, and then how we as a broader society help solve those needs.
I think we can look at often, a lot of issues with public health and even with behavioral health. And I think we all agreed before that it's a huge challenge. But I will say the positives associated with that are one, that we're talking about it. We talk about behavioral health a lot more in the context of health generally. We talk about it less sometimes as kind of a subset. Oh yeah, don't forget about it. We talk about them together. This whole panel did, which I think is significant. And we also did a pretty good job as a state in addressing the opioid crisis. No one, I think, is saying that we solved it, and we're seeing, unfortunately, some rates go back up now during the pandemic. But before that, it was all hands on deck. The governor came in and made that one of the pillars of his administration. We made Narcan available. Providers, physicians, and others learned about prescribing and some of the risks, and we did all this education. Hospitals changed practices internally. We have a system, a statewide system for tracking that, so you could look at risk patients. The General Assembly worked to do things that really we're focused on population health, like with our incarcerated population, and making sure that people who had addictions could get treatment as they come out, so that they don't reoffend. We did all of those things, and we saw deaths go down. And again, we didn't solve it, but we made really good gains from something that was on a trajectory that looked like it was going to be overwhelming. So I think sometimes what it takes is putting one of those things, suicide, maybe some of these other challenges that we have. We just have to find that right moment to put that up on everyone's radar at the same time and work across all those areas. You're not going to solve it, but we make leaps ahead, like we've done with infant mortality. So I think we can do it. And we just have to find the right time to focus on those things and have a work plan and just keep talking about them.
Senator Brown, I think you accidentally muted again. There we go. Yep.
Sorry. I think too, besides just expanding access in terms of what Medicaid covers, we also have tried to make inroads, not necessarily expanding scope of practice, but I know while they're waiting for their credentialing to go through, things like that. That's also important. But I came in after meth as the opioid crisis was ramping up, and we've done some controversial things, the needle exchange and things, but they work. And there are others, problem-solving courts, community corrections is trying to look for more proactive programs. And so, yes, it's a comprehensive look across the state, not just a healthcare issue. But I couldn't agree more with Brian in saying that the fact that we're talking about it at the same level, as opposed to, oh, and by the way, there's that problem over there. And that is something, just having the conversation takes the stigma away and makes people more, I think, open to seeking access. But now with telehealth, it is a concern whether you're an alcoholic who wasn't able to go to an AA meeting or whatever it is. And I think perhaps there will be opportunities to us to figure out post-pandemic how we can make sure people, no matter where they're from and what their access is, that they can get some kind of help.
I think that's key. And now on multiple occasions, we've talked about insurance, uninsured, Medicaid expansion. Certainly one of the impacts recently was Governor Holcomb announcing the 10-year extension for the Healthy Indiana plan. I think it would be interesting to know from each of your perches here what your thoughts are around the impact that is felt in communities from uninsured, and what are some things like HIP that we can do to really, open up that access to care, and what would you recommend even as far as policy actions by payers or providers even to help to eliminate, the number of uninsured that we have in the state? Nice softball question, right?
Well, you're the moderator, but I was sort of curious. Mark, you said something, I think, right off the bat with your perspective from other states, and I know we've talked. I know about your history. I know you've worked in some states that weren't able to kind of do what Indiana was able to do, which is come up with a bipartisan, innovative program like HIP, and I'm sure that changes the face of healthcare. So I'm glad that you mentioned that earlier, but because it's something that I hear from my colleagues as well, that they have some challenges that we may not have in Indiana because we were able to figure that out.
Yeah, absolutely, Brian. In other states, I've seen, rapid closures, particularly of rural hospitals. You mentioned the state. There had been one, I think, right before the pandemic in the southern part of the state, and that's unfortunate. And it's a balance between the fiscal realities. I think Senator Brown brought that up earlier, and we know that all states are dealing with those fiscal realities, and the economic impacts of COVID, I think, are even going to make future state budgets more challenging around that. So, it's an employer issue in these small communities. When they lose the hospitals, as I've seen in other states, it becomes an access issue. So, we are fortunate in the state to not have experienced that, but we continue to need to try to find the balance. There's also, as we all know, physician shortage issues across the country. That's a barrier to access. So we have to, continue to figure out, the solutions to that. Expanding the care, telehealth, we've talked about that repeatedly. One of the things, and I know it can be somewhat of a controversial topic, and quality of care always needs to be top of the list, but based on my other, experience in other states, I've been interested to see that there's a lower utilization of physician extenders in the state compared to others. And, again, various states have varying views on that, scope of practice limitations, et cetera. And I think we always have to place quality of care top of the list. But, could further utilization of those type providers with appropriate measures in place to ensure quality of care is there, but is that a way to help expand access at the same time helping reduce the cost of care? I think, that's just an example of, a different approach or things that we could look at more aggressively, perhaps.
I agree with most of that, I think, but I do think that when we're talking about uninsured, I think there are some things we can do that gap right above the Medicaid and the HIP 2.0 population. And we made a very small step, if you will, this past session by allowing Farm Bureau, for example, to associate and try to get their members. As you can imagine, if you're a solo farmer out in 1,000 acres and it's just you and your spouse, your cost of care is going to be pretty expensive. So that's not going to fit for everyone, although anyone can join Farm Bureau, I think, for $35. So I'm not a member, so I'm not pitching for them. But I do think what we need to look at are other models we've never thought about. And so I think that's one way we can do it. I also think, though, talking about utilization, I thought you were going to say, Mark, in the care, going in the direction of trying to get people to not utilize the highest level of care too. And I think that's maybe been a somewhat of a positive we've seen with COVID is our ERs were overrun with very sick people, obviously, but not overrun perhaps with those who had other options and didn't use them in the past. And so that's not going to fix everything, but I do think from my perspective, it's about educating the patient population as well. This is where you can go. You're going to get the answer and the care you need, but you don't need to go to, your wonderful centers where you can take care of everything, right? And so that's another piece. I'm not sure we're quite there yet with our population.
Yeah, if I could just follow up Senator Brown's comments, I absolutely agree, Senator Brown, in that hospitals are absolutely the highest cost part of the continuum of care. It goes to a comment Brian I think made earlier, which the faster we evolve to a new payment model overall, away from fee for service, where we're paid based on outcomes, I think that will help drive a piece of that as opposed to utilization. And I think too, your very point there of educating the public that they can get quality care at great outcomes, just in a different setting. Perhaps that's the home setting, perhaps that's an outpatient setting, or just an overnight stay or a limited stay in a hospital, as opposed to what was a multi-day stay in years past. So I believe all those things can be solutions to these issues.
If I just might interject, what I sort of take it upon myself to educate some of my fellow legislators, though, at the end of the day, we want tertiary care centers too, right? We want the highest level of care available somewhere. It doesn't have to be in every community. And in order to maintain that level of care, and it could be a great day where no one ever has to walk in, right? Either through the helicopter or through the ER and an ambulance bay, but you still need to maintain that quality of care. And there is a cost to that. And I think when you're doing a great job and there's low utilization, people don't understand you still need to have that that lovely facility going and the cost that accompanies it. And sometimes I think you're a little too good at what you do in a sense, and you don't relay what it costs to maintain that level of care. And that's difficult for the public to understand. And then of course, getting back to the education piece, then they get their bill and you did a good job and it was outpatient and they're only there because I get those, from constituents, like, how could it cost that much? It was only an hour. And I'm just thinking, you're so lucky. You're cured and it was an hour. You're right. But there's a whole army that was working behind the scenes to make sure that you had a good outcome. So
if I could just say,
Right.
I just wanted to on coverage and what we need to do. We've got work to do. I mean, we have HIP and that is fantastic. Really excited about that. We've seen, I think right now, HIP enrollment last year about this time was, I think, around maybe 420,000. It's about 590 right now. And if we had not had that safety net for people who are, working in the service sector right now, I mean, I think I don't know if we'll have data at some point to look at, but I think some of the people in income bracket in industries that are particularly hard hit right now are finding themselves where they absolutely need that hip right now. And it's, we're so lucky to have it. It's great, but we do have to figure out, I mean, we're going to come out of this and Senator Brown is exactly right. HIP is a good model, but with respect to the ACA and the exchanges that were set up, I mean, that's not working. We've seen the numbers go down there in Indiana. The deductibles are too high. The risk model is messed up. And I do think that's one area where we could look to the state. States have kind of maybe thought about different ways to do that. Senator, actually, we talked to Senator Zay about that recently. I think he's thinking about it. But, I think we need to put all the kind of partisan battle around the ACA stuff. Hopefully, I mean, we've got a Supreme Court case, but there are some market-based solutions to help people that are an entrepreneur that doesn't have employer-sponsored insurance. How do we get them to be able to join a pool so that they can get affordable insurance? Or how can we could we create a high-risk pool in Indiana for hemophiliacs or folks that have the highest cost? And could that make then a market-based insurance more affordable for a small business? I mean, we haven't figured that part out, and that's where there's a lot of work to do. I agree.
No, I think these are all really good points. In fact, Brian, kind of where I was thinking of sharing is that as we talk about education, I think we're having a much more engaged consumer, and I use that word very purposefully because so many individuals are feeling the impact of these high deductible health plans, and they're sharing a lot more in the personal cost in that. So issues like price transparency or providing patients with cost estimation or avoiding, Mark, you had mentioned earlier, surprise billing in that. You're just seeing a lot more engagement and calls from this, from across the industry. And we're working with a very complex system here. But, I guess just kind of a silly, more global question, but what's working? What do we need to work on? Where do we go from here?
I think we're off to a good start with the things that we've done here in Indiana. So I don't know if we know exactly yet. Mark mentioned the all-payer claims database because that'll take some time to roll. We at the Hospital Association, we put out in 2015 and still maintain a database for people to compare charges for hospitals. And charges don't have the same exact relevance to what an individual pays out of pocket, but it was a start. And we also put quality information on that. We have to make it easier. I think sometimes there's a little bit of within healthcare, and you said kind of like silly or high level, however you said it. One of the things I've been thinking a lot about lately is we just within healthcare, and we've got this is ACHE, so those are healthcare folks, and people like Senator Brown that know the industry. Sometimes we use too much lingo when we talk to the general public. I think there's a lot of confusion this year when we talked about suspending electives, when hospitals suspended electives. I think a lot of people thought that meant suspending, cosmetic surgery or things that weren't, didn't have a significant medical need. But, replacing a heart valve was an elective surgery, but we still talk about it sometimes in that way. we talk about charges versus contractual allowances, and we run into this in the legislature, right? We're working with smart people, but they might not, healthcare is not their day job, and it gets confusing when you start saying, well, do you mean charge or do you mean price and all of that? So I think sometimes I don't know if this is getting kind of where you were going with it. We're doing some good things from a policy level, but I think we just need to speak to the public in a better way, so that they can really understand the choices they're making. The public's smart, and they are motivated. They have incentives to shop around, but I wonder sometimes if we don't just make it harder for folks, the way we use language.
I'm going to echo that. I couldn't agree more. I try to tell constituents, lobbyists, advocates like Brian, don't ever assume any of us, at least for me, that I know anything about a particular issue or subject, and you need to educate us. But the whole, what's the charge, the price, the good faith estimate, we just had a conversation recently, and really the insurers have that information, but you hospitals have stepped up and are doing a great job of providing that. But it's depending on where you are in your copay and deductible and blah, blah, right, all of those things. And so I think we need to do a better job. I actually am the one who always says, many in our delegation want to keep the patient out of it. And I get that. They don't want to have to be deciding, well, do I need a neurologist or do I need a family practice? We're not talking about that, but we're talking about they need to own their healthcare. They need to say, this is, I'm paying for this, so I need to be one of the decision makers. And we don't always do that. And the hospitals are trying to give them the information they can, but sometimes legislators might get in the way and decide what we need to tell them is not what you actually can tell them, right? And that's where we are. So I try to put the pause. The transparency is good. The good faith estimate is good. It's going to take, I think they said 4 years, which is hard to believe, for the all payer claims database to come out. But I think to that point about what's we have to take it slow and easy, so all the data that we're going to send out, people actually have the ability to use it. Because if we make a hospital come up with massive spreadsheets to hand out to every patient who's coming in for a consult, they're not going to be able to digest all of that anyway. So it won't be helpful.
Mark, I marvel that, even someone in a position as big as yours, I know that patients find their way to you and talk to you individually. What are some key themes that, you've heard from patients, and ways that you within your health system are looking to address these issues? And you've been obviously a very strong voice in the health association, the hospital association. So just would be curious from your thoughts of what you've heard from your patients.
Sure, Ben. I absolutely have, the opportunity to interact with patients. And I'll always tell anyone, if I've ever had a difficult day, the way I make that day better is just get up and around in one of our hospitals. And I have the opportunity to interact with patients and caregivers, and it's rewarding. But what I often hear from patients is, just help us navigate the complex system. As Senator Brown and Brian mentioned, the lingo that we use, it's complicated. Many of the patients, many who are seniors, just don't understand that. And as much as we're moving and using technology to advance care, lower the cost of care, it's still foreign to many of the population, especially that geriatric population. So I think ways that we can help there. And then also, and not to expand into a totally new topic for this, we've got plenty to talk about. But one of the things that I often hear from patients, I hear from our staff, it's probably one of my biggest concerns, is just the adequacy of the workforce. Where is that? Today, where is it moving forward? Especially with the baby boomer population, I think some of it is more regional in an issue than it is perhaps nationally, but it is certainly a national issue. And Ben, as it's certainly an issue for us here in this region. So I think we need to continue to find ways to encourage that workforce development. How do we partner with the educational providers, and then collaboratively again work with our state officials to help ensure that it's there in time of need.
That's great. Well, you're cheating. You're looking at my notes here, Mark, but that was one of the remaining topics that I had. Before I capitalize on that and dive on that, I would just encourage the nearly 40 to 50 people who are online. You have a real unique opportunity to ask a question of one of the some of the panelists here. So I'm going to get my workforce question in, and then I see one coming in. But really, since we're on the topic of workforce development, I couldn't help but think back. I've been in this community for 8 years now. And when I got to Fort Wayne, there was this strong theme of how difficult it is to recruit here. You don't have coastlines, you don't have mountains, you don't necessarily have climate. What we do have is good, strong Hoosier values, a great legislature, we'll get off my soapbox there for a moment. I think for those of us who find this home, we love it, and it's become easier to recruit, but workforce development and workforce retention and recruitment is challenging. I guess let me start, Liz, Brian, with you. You have kind of this broader view of the state, and even comparing us to other states. How do we rank, and what are the things that we're doing to help improve quality of place and to bring a talented workforce here to particularly Northeast Indiana?
Senator, do you want to go? I've got one thing I'll just throw out, and how about I'll just say one quick thing, and then you can go. I think when we think about the state, and I'm thinking about this because the challenges that Senator Brown has ahead in terms of putting a budget together are going to be significant, but perhaps not as grim as it will be in some other states. So I think one of the things that the stability, so we don't have the coastlines, and yes, maybe it's not as exciting, but right now I was on a panel earlier this week and with some recruiters, and they were talking about physician recruiters and provider recruitment, and saying that they're hearing from many places around the state, or providers that are on the coasts that, where rent is high, housing prices are high. COVID has caused a lot of people to rethink kind of what's important and what they want. And people are looking for kind of that stability now. We've seen states around the country, raise income taxes and do other things to try to deal with the economic effects of COVID. And, steady leadership. And I'm not just saying that because we have a legislator here. I mean, it matters, and it's going to make a difference in terms of, what our public education looks like, what the tax structure looks like. All of those things are important. And as we emerge from this, there are some opportunities, I think, to have people maybe return to Indiana or think about it a little bit differently. That's not going to solve the whole pipeline issue, but there is some opportunity there.
Yes, I think, we're conservative in terms of making changes, but at least you don't get whiplash here. We move slowly towards a direction. So I think certainly in terms of physician recruitment's tough, right? But that's going to be tough anywhere. And since I've been in the legislature, I've tried to really push to get us to try to expand our residency programs and things like that. And that's a tough sell, to be honest, because people don't understand how much it costs to train a doctor. They don't understand how long it takes to train a doctor, quite frankly, generally. And so, and they don't understand that it's not the medical school where it stops. It stops at the end of the residency. That's, kind of when they start looking where they're going to land. So that's that piece. But in terms of the rest of the workforce, that's a huge problem. And I can only say the best thing is if there are a lot of voices saying that we need our community colleges of Ivy Tech, we need our high schools even to give them that career pathway. We need our four-year colleges to really push for those sorts of things. They're rewarding jobs. It's not just CNAs and RNs and BSNs and NPs. It's the whole, occupational therapists, the whole gamut, right? And I think I could speak for at least several of my colleagues. We are a little frustrated at how slow we are sometimes to react to what the workforce is. We're not talking about just a career tech, training them for the job, but we know there's a shortage, and we've tried to do some things, but if there is a broader support for encouraging the local Ivy Tech, or in my case, Purdue Fort Wayne with its IU component to do things, I look for that. You know, we have some limited scholarship programs, for example, like Marion, the osteopathic school down there. But that, again, that's not a really big impact. We also have tried to be responsive by passing the Nurse Compact, which allows nurses, it was really seemed to be an issue more on the Kentucky border, to go back and forth. So sometimes it's not just going to be, you know, us spending money on educating them, but you showing us that the pathway to get to their work is going to be shorter in terms of their educational requirements, letting us maybe move it up faster, which we did with some behavioral health people. You know, they don't have to wait until they're degreed and pass their test to start working in their field, that kind of thing. And that's not something I would feel comfortable to impose unless the professionals in the area said, no, we're good, we'll be monitoring them, right? That sort of thing. And but we need to know about those things. And I guess it goes back to where we started in the beginning of this. If there are barriers to licensing and things like that that we have, then we should be able to talk about those.
That's excellent. Well, with that pause and no one jumping in, I'll move to a question that came through on the chat function. I want to thank Sarah for sharing, but for each of you, she's asked, what is the number one thing that you would like to achieve in 2021?
Attending a Major League Baseball game, I think. But I suppose I'm sure that's not what she meant. But it's hard. It's honestly, it's hard to think about anything other than we'll just say the end to COVID is like, maybe that's, but I would say what I want to achieve is we've had a great partnership with the State Department of Health. I think the world of Dr. Christina Box and her team, Lindsay Weaver and others. And we've got not only do hospitals have to take care of patients that have COVID or other conditions, but we've got a lot of work to do as anchors of the community, Parkview and Lutheran and others around the state, working to vaccinate our community and our healthcare workers. I think implementing these positive things are out there, the lights at the end of the tunnel, these therapeutics and the vaccines, kind of working with the health department actually to successfully roll those things out throughout the state. That's really exciting. And I think it's motivating right now because we're getting very close to being able to start that stuff. So that's what I would say.
I was actually going to say maybe to have all of my family together because we're on 3 continents, and as long as they're quarantining, it's going to be a while. But I think that's actually a good point about the vaccines. I'm actually, to be honest, a little nervous about how the public is going to perceive this, and not because of the political and the election, just because we've got some people in the state who are not favorable towards vaccines, quite frankly. And, you know, we have the flu shot now that people are being asked to get, which I already got. And so I am a little concerned about how we're going to roll that out. I want to make sure that as many people who can get it will get it. And I mean, I'll be first in line if it's appropriate for me to do that. But I do think that's going to be a significant, it's impressive what we've accomplished with Lilly in our own backyard and their monoclonal antibody cocktail, whatever that is, as well as Pfizer's announcement. But I certainly hope that we as a state and a healthcare community can convince the public that this is the right way to go, because we don't ever want to go back to this, that's for sure.
Senator, you're right. That's going to be a challenge. Some of the polling and things that we've seen nationally, it's not very good. So it's going to be tough. Yeah.
Well, for me, I certainly would echo everything the senator and Brian have mentioned about COVID. I look forward to those ball games and concerts and all those fun things as well. I share the concerns around immunizations, the vaccinations, and how those are going to be perceived. I'm going to keep the glass half full and hope that we're closer to the end than we are the beginning. But that aside, I'm going to say, my goal in 2021 is the same it is every year from a professional perspective and the organizations I've been honored to lead, which is simply improving the quality of care. If it's a continuous journey, it's never ending, it's every patient, every time. And to the extent that we continue to make progress in that, that's the organizational goal that I will aspire to in 2021, as I have many years. So that's a great question.
That's great. Thank you all. Chad, I see your face joining us online. That must mean that we're getting close. Do we have time for maybe one more question, or would you
Sure.
like to move to closing comments? So, okay.
Yeah, no, good. Go ahead.
So anybody else? I just want to kind of open up. We've got quite a few people online. Any kind of lingering questions in your mind? I guess not. My question was going to be what you're tracking for next year as well. So, maybe I will just share kind of a few closing thoughts, Chad, and hand back over to you. So, again, I want to thank each of our panelists. You've provided us with just such authentic thoughts on where we're at here, and it's clear why you're experts, recognized as experts in the industry. Brian, I can't help think about where you've mentioned, our health system is fragile, and yet there's a core of resiliency, and so I know that that's nothing that we take for granted. And there's been so many deep examples of how we've talked about that. Senator Brown, how you've shared that, it takes a lot to deliver the care that our community really a lot of times doesn't think about it until they actually need it. So for each of you who are on the call, you are healthcare leaders in your own right, and really do appreciate all that you're doing to aspire to grow in your profession and help make our industry even stronger so we can deliver on that excellent care that Mark talked about to those who call upon us. Really want to thank you for the thoughtful comments. I think it's really reflective of just what it means and why we have such a strong environment here in Indiana. Couple other comments that I captured in my notes. I know that we spent a lot of time talking about behavioral health, mental health issues, but I think talking about all issues more globally, there's been a lot of great thoughts here that we've talked in. And I think to advance the dialogue around telehealth, around the opioid epidemic, around mental health and pricing transparency and the host of other things that we've covered, talking about it is going to be a very important ingredient in moving ahead. And kind of coming back to something that I know each of you had mentioned is just leadership. And so thank you for your leadership. Leadership matters, and no more so than in this time where we are facing the strongest pandemic that we've ever seen in our lifetime. So applaud your efforts and really do appreciate the partnership that you've extended. So Chad, thanks for the opportunity, and I'll hand back over to you.
Wow. Well, great work, Ben. And to the panel, Brian, Liz, Mark, Ben, really just thank you for your expertise. I think Ben summarized it up very well, and I don't really have too much to add there. Just great work. And I just want to acknowledge how much time and effort the panel and moderator put into the night during what is definitely an unprecedented time period. Apologies for getting kicked off earlier. We're going to do some housekeeping. Part of our bylaws is a final vote on new board members. So this is a proposed slate that we had previously at a meeting. Part of our bylaws is to do a final vote. We have David Blish, Sheila Kelty, Michael Kuhn, Cumbia Lewis, Monty Spence, and Sean O'Brien as our new board members. And we'll take a vote electronically, first time taking a vote electronically. But we ask pretty much if anybody is opposed. So if anybody is opposed, please put that in the chat feature. And this is something that as a part of our bylaws that we put in front of our members here. So we'll pause to see if anybody does. and I'm not seeing anything come up. So these will be our new board members. We appreciate the excellence of these board members and the diversity from a career perspective and other elements of diversity as well too, as we look to continue to bring excellence to the board there. Finally, just want to say thank you to our sponsors again, Ice Miller, Heapy, End of Care, Cornerstone, Arc Design, Cat Sapper Miller. Could not do this without you. And a final thank you again to the moderator and panelists. Appreciate the time and effort that you put into this. So with that, we will see you at a future event. Please follow us on Twitter, LinkedIn, and we hope to see you at a future event. So thanks again for your support of IHAN. Have a good night.
Thank you so much, Chad. On behalf of ACHE, I want to thank our chapter leaders who planned today's session, moderator,
COVID,
and panelists, and all of you for your participation. Please complete the course evaluation by visiting your My ACHE page on ache.org and selecting My Online Learning from the Helpful Links section on the right side of the screen. From there, click on Access My Courses, and you will be directed to our learning management system where you can complete the evaluation. In the same location, you will be able to access the recording of this session within 48 hours. Your face-to-face credits will be posted to your My ACHE account approximately 2 weeks following the session in the My Education Credit section. That concludes our session, which is copyrighted in 2020 by the American College of Healthcare Executives, all rights reserved. Thank you all so much and have a great evening.